That's great. So, as far as paired kidney exchange, um, Stanford Hospital and Stanford Children's has been participating in this for at least 10 to 15 years. I don't know exactly the date that we started it. The Stanford Children's um, has been participating in the kidney exchange through a program called the National Kidney Registry, and also known as the NKR. And it is a company that helps provide the logistics and the registries to match with other recipients and donors out there. This is the largest company available and probably the most popular company that's used to do the kidney exchange. The number of people that we have, we offer kidney exchange for all of our patients, but the number of people that have participated in it have probably been about approximately 5 to 6 that come to mind. And they've participated in several ways. Some of them have participated in being advanced donors, where they donate now so that their child can receive a kidney in the future when they're ready for transplant or appropriate for it. Some people have gone together and donated at the same time that they received the kidney, and that's what we call a true peer exchange. And we've had people who didn't even know the recipient enter into the exchange to find them a valuable kidney for transplant, and this is known as non-directed donation. You can argue when it comes to living donation, um, sometimes we are limited by the type of kidney that we can choose for a child, especially for a very small child. It might be because of the anatomy of the kidney or like the size of the kidney. And so we try to always optimize um, the ways they could get a kidney transplant, whether living donation or through deceased donation. As far as other challenges, when it comes to disease donation, organ allocation, there are challenges in that uh, the best kidneys sometimes are allocated to other patients aside from pediatric patients. And but that's an ongoing debate as far as where those kidneys should get priority at. Absolutely. Past data looking at the decades of donation, people who have donated have been people who are in a higher income or come from zip codes where there is more college education and higher incomes overall. And so definitely to create equity in the field, legislation to promote support for lost wages and things like that definitely is something that, in my opinion, should be done for people who want to donate organs. Other legislation is that is commonly talked about is how we opt in or opt out for deceased donor organ donation. And meaning right now the system in the United States is an opt-in system. And so one legislation that possibly could increase the amount of organs available is have it as an opt-out system where people can at the time of, for example, is signing up for a driver's license would actively opt out of the system if they did not want to become a donor. Well, obviously, any time of year, I think Donate Life Month is a great month to, bring focus back to organ donation from living donors and deceased donors. And as far as the role that nephrologists can play, obviously, nephrologists are dealing with patients with kidney disease. And uh, I think if they have patients who have chronic kidney disease, to think about and educate their patients about kidney transplant and organ donation, especially living donor organ donation early on. And so that if people do have a living donor or available, they can actually plant that seed so they can start thinking and talking about it before the need or emergent need for dialysis comes up.